Scarlet fever is the disease I decided to present today. It is an interesting disease because it can seem to be a simple illness like the common cold, but it can become life-threatening if it goes untreated. It affects the respiratory system as well as the digestive and integumentary system. The history of scarlet fever peaked in early 1900s and the mortality rate increased. Research suggests that this disease continued mainly due to poor living conditions and unclean hygiene habits. Scarlet fever is well known for having the telltale signs of a rash on the tongue known as the strawberry tongue. The rash can then spread from the abdomen to the extremities. Usually affects children between the ages of 5 and 15 years of age. It is important to understand that the GABHS bacteria can also cause pharyngitis and similar rashes. The capsule is considered a virulence bacteria because of its enhanced ability for the bacteria to cause disease, preventing phagocytosis. The capsule can protect cells from engulfment by eukaryotic cells such as macrophages. A capsule-specific antibody may be required for phagocytosis to occur. S. pneumoniae is a normal member of the respiratory tract flora. Invasion results in pneumonia. Scarlet fever is caused by the bacterium S. pyogenes or group A beta hemoglobin streptococcus, the same bacteria that causes strep throat. It is a gram-positive cocci. Even though people become infected out of only 10% of the population, there is a higher rate of becoming infected in higher populated areas. It is important to be aware of outbreaks in specific areas that may be at risk. The disease often sets in after preceding viral infection damages the respiratory ciliated epithelium. Incidence therefore peaks in the winter. In the untreated patients, fever peaks by the second day, getting temperatures as high as 104 degrees. Gradually returns to normal in 5 to 7 days. The fever will reduce 12 to 24 hours after receiving the proper antibiotics. A recent history of exposure to another individual with a strep infection may aid in the diagnosis. The diagnosis can be confirmed with a sputum gram stain. The main deterrent in avoiding this disease is to keep proper health and good hygiene. However, strains resistant to penicillin and multiple antibiotics are rapidly emerging. There is no vaccine available. However, patients can also be given erythromycin or amoxicillin and ampicillin. Over-the-counter drugs such as ibuprofen or aspirin can also aid in the pain and fever reduction. These are some of the photos of young children with these symptoms associated with scarlet fever. The strawberry tongue in the top right, the rash spread across the trunk on the left, as well as the rosy cheeks and or flush-looking face in the bottom right. It kind of looks like a sunburn, and the skin does feel rough to the touch, like sandpaper. It can also be itchy in the infected areas. These are the resources that I used during my research. I highly recommend the Mayo Clinic website. There's a lot of great information and other links to delve deeper into this disease. I hope you enjoyed this presentation and thank you so much for your time.